So good evening, Professor Reddy. Thank you for joining us. So if you wouldn't mind, please briefly introducing yourself.
I'm Srinath Reddy, President of the Public Health Foundation of India.
Thank you. So generally, what are your thoughts on the future of health and care systems?
Well, I think the future of health globally is to try and provide universal health coverage in terms of a wide array of health services, but at the same time ensure that health is assured to people through health promotion and disease prevention, not just through health care. So we ought to look at efficient health care, which is equitable, but at the same time look beyond health care itself, where we need to provide a health assurance to the population through health promotion and disease prevention, which is built into overall health system.
And how do you see health and care systems evolving in the future?
Well, I believe it's very important for healthcare systems to become much more committed to the idea of equity apart from efficiency and access, and removing the widespread inequalities that are there now, even in the availability of healthcare, and the barriers to affordability is going to be a very important challenge. But at the same time, there has to be a much greater democratization of the healthcare system. So a person-centric healthcare as well as a community-centric public health. These are the features that ought to emerge much more clearly.
And what three opportunities do you see for these systems?
Well, there are plenty of opportunities. Firstly, there is never before seen level of political commitment at the global level to universal health coverage and to primary health care. We have seen the Sustainable Development Goals as well as the Astana Declaration. But also, health has now been put prominently in the framework of integrated development through the Sustainable Development Goals. Secondly, there is also a greater realization that the social determinants of health, the economic determinants of health, and the commercial determinants of health need to be acted upon if you have to protect and promote health of populations and not just build systems for health care. The third is the emergence of technology as a potential great enabler of health care and health services in order to improve their outreach, equity and efficiency, and also provide the data which can lead to much more informed decisions.
And what three challenges do you think that each of these opportunities would face?
Well, one of the biggest challenges is the lack of adequate public financing. For a variety of reasons, many countries are slipping back on the level of commitment to public financing. And unless the government recognizes its role as a guarantor of health to the society, even if it is not the sole provider of services, and ensures that whatever finances are flowing are principally directed to public good, and that will only happen when the government also puts in a fair share of public financing. You are not going to get universal health coverage, you are not going to get a strong primary health care system. So apart from the political commitment, you need to see it actually translated into a greater level of public financing. The second challenge, I believe, is that there is no clear-cut platform for an all-of-society effort to bring about a healthier population as well as a better healthcare system. We are still fragmented across different silos and sectors, and unless we bring all the sectors together, a case in point is access to drugs. If you have a challenge in terms of intellectual property versus social contract, and a number of the drugs that are necessary and even life-saving become inaccessible to large sections of the global population, then that defeats the purpose of universal health coverage. So how do you bring in all of society into one platform? The third, I think, is the health workforce crisis, which still needs to be addressed, and particularly when the populations in high-income countries are aging, and they're not going to find many people entering the health workforce, and the lower middle income countries already have a severe shortage, if you're going to see a large scale migration of the health workforce from the lower and middle income countries into the high income countries, that can precipitate a global crisis. So how do we co-invest in developing a much larger health workforce globally and make sure that everybody gets the kind of healthcare provision needed? That's going to be an important element, and that calls for solidarity. I think the key ingredient for success of global health in the future is going to be solidarity within the countries and across countries. Without that social solidarity, UHC will remain an empty slogan. The health workforce will continue to be drained away from poor countries to rich countries. You're still going to see drugs becoming inaccessible. So unless we bring in that social compact, we are going to see global health falter. On the other hand, social solidarity is a platform upon which the future of global health can be built.
How can we reconcile the deep health inequalities that we see and at the same time engineer innovation?
Well, I think innovation is also a method of overcoming inequalities. Of course, income inequalities need to be tackled. In an era of growing income inequalities, redistribution of wealth, employment opportunities and educational opportunities for those who have been left behind, those are going to be absolutely critical. But in terms of health inequalities where service delivery has been inequitably delivered, innovations in healthcare delivery, particularly through appropriate use of technologies, can actually extend the outreach of services to the last mile. And that is where we can actually look at different ways of ensuring better access. Secondly, innovations can also come about in the way we regulate health systems. Governments, for example, are important regulators who should offer both incentives for better healthcare practices and disincentives for poor healthcare practices. So I think there again, innovations are possible across the board, which can reduce the inequalities.
And what are the main lessons that you feel India can teach other health systems?
Well, we are still in a phase of experimentation because we are facing severe challenges. But I believe one of the things that we actually can teach other countries at this point in time is a much greater amount of commitment to primary health care, which has emerged very strongly, at least as a political commitment. How it's going to be translated into stronger healthcare delivery systems, we'll have to wait and see. But the other element that we can actually teach is that it is because of our commitment to reducing inequities that our production of generic drugs, for example, has made it possible for drugs to be becoming much more accessible, including life-saving drugs, not only for India, but for the rest of the world. So we are the pharmacy of the world, and that is again an indication of our commitment to bridging the equity gaps. And the other element that I believe that we can actually teach is that we are engaging many systems of medicine, not just allopathic systems of medicine, the traditional systems of medicine as well. And we are bringing the community into closer contact with the healthcare system through all of our healthcare providers. And I think having a very strong community engagement in designing the programs and monitoring the programs is going to be an important element. And some of our experiences in this area can be potentially helpful to others.
Thank you very much, Professor Reddy.
Thank you.